Most cases of sciatica involve compression of the L4 or L5 nerve root where it exits the spine. Compression may be caused by bulging discs or stenosis from degenerative joint disease. This is a top view looking down at a lumbar disc bulging towards the rear and contacting nerve tissue. The pressure generates pain in the sciatic nerve, which begins after the lumbar nerve roots merge at the gluteus area and often radiates further down the leg, sometimes all the way down to the calf and foot. Lumbar extension exercises may help compress the disc bulge inwards, removing pressure from the nerves. Start out conservatively and gradually increase the intensity of the extension force. Level 1 simply involves lying down on your stomach on a firm surface. This angles your pelvis forward and puts an arc in your low back. Note, if you have a large belly, it may prevent this arc from forming. Lie there for 10 minutes. Stand up and note changes. Do 3 times a day for 3 days. Level 2. Lie on your stomach with your arms placed as shown and prop yourself up on your elbows. Hold for about 10 seconds, relax and repeat. Go along with this video to practice timing. Make sure to release any muscle guarding in your low back and allow it to arch more sharply. Stand up and note any changes in your sciatica. Do 10 reps 3 times a day for 3 days. Level 3. Lie on your stomach as before. This time place your hands under your chest, forming a triangle with your index fingers and thumbs. Extend your elbows fully and allow your stomach to drop down. You should feel an even stronger force in your lower back. Hold this position for 5 seconds, lower yourself, and repeat. Do 10 repetitions 3 times a day for 3 days and note any changes in your sciatica. Level 4 requires an assistant. Lie on your stomach in the same position as Level 3. Have your assistant position herself to your side and place her hands on your L4, L5 level or base of your lumbar spine as demonstrated. Push yourself up and tell your assistant to add some resistance by putting some of her weight over her hands, but still allowing you to raise up. Hold this position for 5 seconds, then lower yourself, rest for 3 seconds, and repeat. Do 5 repetitions twice a day for 3 days and note any changes in your sciatica. Signs of improvement include less frequent and/or less intense sciatica pain and diminishing pain in the leg moving closer to the spine. For example, you previously had pain all the way down your calf, but after doing these exercises it reaches just to the back of your thigh. If your condition is improved after completing this series but symptoms remain, do 6 more days of Level 3 or Level 4 exercises. If your sciatica still hasn't cleared after this, continue with the steps in the next lesson. Proceed to the next video or review this one to reinforce your understanding before you do the procedure.